Hi, folks. This is Sam Maranto. It's in the afternoon. It's hot as the sun again outside, almost 100. And I'm in the house where it's nice and cool with my buddy next to me. And this is when I get some of my best ideas. I want to talk to you about depression. Depression, the doctors will tell you it's a chemical imbalance. And they've got pills and medication that can tweak that and help you to feel better. And I think it's wonderful for temporary use. But the side effects, ooh, most of the shootings and murders, people were under the care of doctors taking medication, a lot of, especially some of these young people, and the side effects are suicidal tendencies, skin rashes, hearing problems, eyesight problems, liver cancer, not per se just for those drugs, but for different drugs, legally they have to tell you the side effects, and a little voice comes on and somebody's dancing on TV with a big smile. I'm cured, and they're smiling and everything, and the little side voice comes on telling you how dangerous it is. Some of these drugs are dangerous, folks, and I'm telling you, seriously dangerous. You know, in the United States, we're the greatest country in the world. We take more prescribed drugs than all the countries in the world combined. All the countries in the world combined, the greatest country in the world takes more prescribed drugs. 30, 40, 50 people a day die from being overmedicated, from taking drugs. And let me tell you what depression's all about. If you're not happy, Abraham Lincoln said, you're as happy as you make up your mind to be. And when you're happy, you'll make better chemicals than any pharmaceutical company will ever make. When you're not happy and you're depressed, the medication is supposed to calm you down, make you feel better. And I don't want people coming off of medication. They'll say, hey, Sam, you're practicing medicine without a license. Go ahead, swallow the stuff that they tell you to swallow. Go ahead, take it. You know, take high blood pressure. There's natural things you can do to lower the blood pressure. The side effects to high blood pressure medicine is diabetes, cholesterol problems, and a lot of other side effects. And this is not just my saying. Look it up for yourself. You know, I got to tell you a case. I don't know why I want to tell you this case, but a girl about 28 years old came to my office one time. She saw me on a television show. She says, I'm home on leave from a state hospital in Missouri for Thanksgiving. I saw your show and I want to talk to you. I says, well, how can I help you? She says, well, I'm living in this mental institution, and I've had over 101 shock therapies. Beautiful 28-year-old girl, 101 shock therapies. What are you talking about? I says, what happened? She says, well, I was in school, in college, studying to become an attorney in law practice. And I had a crush on the professor. He was a good-looking guy, and I kept looking at him. And one day he called me up in front of the whole class, and he said, why are you looking at me all the time? And she didn't say anything. He said, look it, there's a door. Get out of my class. I don't want you back in my classroom anymore. I'm expelling you from my class. Don't come back here anymore. Well, she got depressed. Who wouldn't get depressed if somebody threw you out in front of 30 people and told you to leave? Well, her father took her to a psychiatrist. The psychiatrist gave her medication. She laid on the floor, went into a convulsion at home. The father called up the doctor. The doctor recommended the hospital. Then they recommended a state hospital, and he signed the papers and 102 shock therapies. This girl's life is ruined because of a stupid, idiot doctor. Now, I'm not knocking doctors. I love them. I know a lot of them personally. But I could have straightened this girl out in 2 minutes. Instead of the doctor saying, hey, never mind that professor, he must have had a bad day, don't let it bother you, you're going to be okay, go in a different class, make her feel good, make her understand, she would be okay today. Instead, the medication gave her a convulsion, she ended up in a state. Folks, it was kind of late for me to be able to help her, and I couldn't help her anyway because she's under the care of doctors. You know, I love psychiatrists, I love doctors, and I'm going to tell you right now, I've had more psychologists and psychiatrists that you can imagine that have taken my course. Here's what one psychiatrist said. Dr. Norris, a retired psychiatrist, he says, I've been a psychiatrist for 35 years, and I've learned more in 2 weeks on your course than all my medical training and all my practice for 35 years. Now, how can a medical doctor or psychiatrist say you learned more in 2 weeks on my course? I don't BS people. I get right to the chase. I get right to the problem. And I'll tell you where the problem starts. When you're in your mother's womb and she's pregnant, at 40 days of conception, you're about the size of a finger, your brain's intact, you start picking up. If mother likes a certain food, you may crave that same food. You've heard of that. Well, when I was pregnant, I craved the same food that Johnny craves. If your mother's depressed or unhappy, depression's growing in the womb. If a mother wants to have a little girl and it comes out a little boy, the little boy thinks he's a girl. A lot starts in the womb. My mother loved to dance. And here I'm in my 80s. I take my wife dancing. I throw her around the place. We still do the old jitterbug and stuff. I'd like to dance. The program was put in my mind. So if your mother's depressed or unhappy or had problems or you're fighting or arguing, you could be born a basket case. You could become a billionaire and always be depressed and popping pills and trying to find help when it's so simple. People can get help with depression so easy. You can go to my website, GodWillHelp.com, GodWillHelp.com. Or you can go to Sam Maranto. People spell it wrong. It's MERANTO, MERANTO, or GodWillHelp.com. And you can download my sessions now. I'm going to be retiring. I'm putting them on where you can download them right there on the internet. And you can put them on your iPod. You can listen to them at home. If you live in China, Ethiopia, no matter where you live in the world, you can get help all over the world. Folks, you're looking at a guy and listening to a guy that was born November 3rd, 1931. I'm still doing things I did at 40 years old. I've had some accidents. I've had some problems. I had to recoup them myself. I want to teach people how to, if you had an accident, if you're overweight, you got high blood pressure, you got acid. In fact, acid reflux goes away in a matter of days on my program. And they got these little pink pills with all these side effects. Look, I love you. I don't have to work anymore. I'm doing this because God wants me to carry on my work. I've got 1,800 sessions. You can download sessions on the internet. I got the cost down low because I don't have the expense of the office and people in the office. I got the cost down low. When I started, hospitals were getting $500 a day for their room, and I got so much from my program. They're getting $3,500 for a bedroom now, for the bedroom. That's not counting anything else. Folks, if you need help for depression, for pain, for weight problems, alcohol, drug addiction, getting along with your spouse, attracting the right mate, whatever you need, go to sammaranto.com or godwillhelp.com, and God bless you all. I love you all. Share this with a friend if you love them. And if you don't love them, share it with them anyway. Love thy neighbor as thyself. God bless you all.